My name is Dr. Aston. This is the second video in our How to Avoid a Knee Replacement series. In this video, we're going to talk a little bit about some of the more common treatments for knees that, while can be effective, often lead to a knee replacement. I like to call these treatments pathway to a total knee replacement. And so first, let's do the breakdown. So back to this model here, we talked about this varus deformity, meaning the medial side or the inside of the knee touches the tibia and the femur and causes a breakdown of cartilage. Okay, that breakdown of cartilage is meniscus tissue typically. So that meniscus begins to fray. And so that's about the time the patient starts to notice pain, starts to develop symptoms. So they're going into their providers and saying, hey, what can you do for me? And the most common thing that's offered first is a cortisone shot. And so a cortisone shot is typically injected into the knee. I'm sure many of you have had a cortisone shot before. Cortisone shots are great at reducing pain, but what they don't do is they don't fix function. Okay, so they don't restore function, they just mask symptoms. And when you mask symptoms in a weight-bearing joint that has developed friction on one side, you're setting yourself up for a total knee replacement. So let me explain. So as we discussed earlier, meniscus is spongy cartilage. Now spongy cartilage, imagine a sponge when it's moist, right? A wet sponge. It's going to bend all day long, right? It's going to be very elastic. Well, imagine if you have a dry sponge and then you try to twist it and bend it like you did before. Well, it's going to probably tear or crumble, right? Well, so when you inject cortisone, it's acidic. And when it's acidic, when something's acidic, it dries things out. And so when you dry out this spongy cartilage that is being impacted by the bone above it, what do you think is going to happen? Well, it's probably going to damage that cartilage more and break it up and further degenerate the joint at a much rapid rate. The other thing that happens is cortisone actually increases osteoporosis by 4 to 8% in the area that's been injected. So now you've just softened bone in a weight-bearing joint. Do you think that's going to have an impact on it? I mean, this joint is basically touching bone on bone here with weight on it, and you've just softened the bone. It's probably going to degenerate even further. And so then the next phase that we typically see in the patient is, now that they've damaged this meniscus damaged further, they typically will get what we call a meniscus repair, which is basically a meniscus removal. And so they're going to remove the meniscus from this area. Now, meniscus repair surgery can be very helpful in some circumstances, but in a varus deformity situation, typically it's not going to help at all. It's actually going to cause more pain. And so those are the kind of the steps or the gateway I like to call to a total knee replacement. And so at Core Medical Center, we try to use some different approaches to avoid this scenario. And we'll discuss some of those approaches in our next video.